everyone. Dr. T. Haritha Kumari, a consultant neurologist practicing in Nellore. Today we are going to talk about and discuss about an important topic, that is regarding epilepsy. Is epilepsy curable and what are the treatment options? Patients with epilepsy lead a normal life. Okay. So when we talk about cure in epilepsy, typically we talk about control of seizures. So which in most cases only we can do it with medication. Sometimes epilepsy surgery also we can do. So regarding treatment options, if we see, first comes medications. There are many types of medications. Which medication your doctor chooses will depend on your seizures type and how old are you, any other medical conditions you have and other medications you may be on, and whether you are a female or childbearing age. If you are a female, the treatment changes. If you are childbearing age, if you are a pregnant woman after delivery, the medications and all will changes. The medication will change depending on the seizure type also. Whether it is a focal seizure or generalized seizure, on which area it is arising, depending on all these things, the treatment will change. So when your doctor prescribes medication, they will choose only something is when they feel that some medication is suitable for you. So not everyone with epilepsy will be on the same medication. The medication varies regarding and depending on the seizure type and depending on the person type. So the medications which we use are anti-epileptic medications. To 70% of people with epilepsy have their seizures controlled with these anti-epileptic drugs. So if patient do not respond to medication, so like when they are using correct medications of correct choice, correct seizure identified, so then with 2 or more anti-seizure medication, then we call it as drug-resistant epilepsy. So what is drug-resistant epilepsy? With 2 or more anti-epileptic drugs of correct choice and correct seizure type identified, even then the seizures are not controlled, then it is the drug-resistant epilepsy. In these cases, epilepsy surgery may be considered. Seizures are not responding to medication. So the aim of this surgery is to stop or reduce seizures. When the seizures do not respond to anti-epileptic medication and the seizures are disabling and impacting seriously on daily quality of life, a seizure focus is identified and can be safely removed. In these conditions, epilepsy surgery is done to achieve seizure freedom and to control seizures. So another treatment option is vagus nerve stimulation. It is a form of treatment for people whose seizures are not controlled with medication alone, or in patients who have failed surgery, or in patients who do not want surgery. The aim of this vagal nerve stimulation therapy is to have fewer seizures as well as shorter and less severe seizures. It is used together with medication. So the VNS, vagal nerve stimulation, is a device powered by a battery, and it is placed under the skin of the chest wall on the left side with a wire attached to the left vagus nerve. So the stimulation of vagus nerve can reduce the frequency and intensity of seizures in some people with epilepsy. So these are the type of treatment options to achieve seizure freedom. Other type of thing is ketogenic diet therapy. So it is a extremely low carbohydrate and high fat diet used to treat epilepsy, which has not responded to other treatments. What is this diet? Is actually ketogenic. It implies it's a fat diet. So body uses fat instead of sugar for energy. This fat produces ketones. The ketosis prevent the seizure recurrence and it causes increase the threshold of seizure potential, so the seizures will be controllable. So it requires detailed medical and nutritional assessment to ensure there are no underlying conditions that would make a ketogenic diet dangerous. So under doctor's supervision and after assessing everything, so is the ketogenic therapy is fitting for you, then only KDT is prescribed by your epileptologist or physician. So another thing is, can someone with epilepsy lead a normal life? Most people with epilepsy can live a full and active life, working, they can play, they can sport, they can socialize, they can travel and take up hobbies, and they can plan a family, they can pregnancy and child, everything can be happened. So the one thing is the females at childbearing age and before pregnancy, they have to consult neurophysician regarding seizures and adjusting the dose and whether there is change in the epilepsy medications. They should do everything before planning pregnancy. This is very important to prevent abnormalities in the child and fetus. So if seizures continue, some changes may be needed for safety reasons. but it is still important to keep up as normal a lifestyle as possible. So this is the thing regarding epilepsy. Thank you.